Hello everyone. I'm sure you have heard of medical malpractice from the news more frequently in these 2 years, right? The cases of retaining instruments in the patient's body after surgery and also ABO incompatibility blood transfusions are the examples. They may cause side effects or even death to the patients. This sounds horrible, but it's true. Don't think that it is irrelevant to you. You may be the victim if this problem hasn't been solved. So solving this problem is necessary and also very urgent. I agree that doctors and nurses are normal people just like us. They still have chances to make mistakes. But are these mistakes unavoidable? In fact, there are several solutions that can be done by the hospital authority step by step to minimize the errors. I've written a proposal on these issues and include those practical solutions. Let me introduce them to you in the following time.
First, the hospital authority should increase the salaries of doctors and nurses. This can attract them to stay in the public hospitals, so that the loss of doctors and nurses can be solved. This measure may increase the economic burden of the hospital authority and Hong Kong government. Therefore, reforming the structure of the authority is helpful. For example, cutting off some positions in the executive management which has overlapped in their working scope. This helps to rearrange these resources properly, and the authority can make use of it to increase the salaries. The second stage is to reduce the workload of the doctors and nurses. The hospital authorities should cooperate with the Legislative Council to forbid the mainland pregnant women to give birth to their babies in Hong Kong. If doctors and nurses can work under a condition of shorter working hours and lighter workload, they have fewer chances to make mistakes. This can detain them to stay in the public hospital too. So, this suggestion is practical indeed. The next stage is to employ overseas doctors. This can compensate the problem of losing doctors and nurses. Some people may oppose this advice as they think the quality of overseas doctors is not guaranteed. But Singapore applied this advice few years ago and it is workable. So Hong Kong can follow Singapore without any worries. Although increasing the quota of medical students is an alternative way, it is not effective enough to solve this urgent problem as it requires at least 6 years to train a medical student. As a result, employing overseas doctors is a much effective way. Finally, the hospital authority should review the above initiative frequently, whether the cases of medical malpractice have decreased.
Medical malpractice is a very serious social issue that relates to citizens' life. The hospital authority should not ignore its seriousness anymore. Looking into the matter as soon as possible is the only way instead. Increase the salaries of doctors and nurses, followed by reducing their workload and employing overseas doctors are the solutions that can solve this problem step by step in a shorter period of time. Even though it may increase the expenditure, it can guarantee the quality of the medical service. Ensuring the quality is the major premise. Otherwise, the citizens will lose their confidence to the authority and the government. At last, I urge the authority to adopt this proposal and take actions on it as soon as possible.